The causes of male infertility. In this video today, we are going to talk about the causes of male infertility. By the end of this lesson, you'll be knowing all the causes of male infertility. If at all you are a couple and you have tried to get pregnant, but things have not worked out very well, things have not worked out fast, then this video is for you. If at all you want to find out why you have tried to get pregnant, but things are not working out very well, and much of the fact is that we need to understand the causes of male infertility. GERALD MASSA, the health educator, and on this channel I talk about women's health. I talk about fertility, infertility, polycystic ovarian syndrome, endometriosis, and all other conditions regarding women's health. The causes of male infertility. So without further ado, whenever we talk about infertility, this is a sensitive topic because many of the couples, actually 40% of the couples, are having issues with getting pregnant. So many times the news and all the platforms, they talk about women having issues with fertility, but normally rarely do we talk about men having issues. So the most important thing we need to get from this lesson today is that much as a woman may be having some issues, if at all they've been found out, like after doing tests, it is very important to realize that also the man may be having some issues in regards to fertility. So whenever you are a couple and you have tried to at least get pregnant for a period of 6 months or even 1 year, it is high time you schedule an appointment to go and talk to your doctor or to go and talk to your gynecologist. So the things or the key areas you need to note when you are planning to go and see your doctor is that you need to have a record of the following information. Number 1, you need to have a record of your last normal menstruation period date. You need to record the last date you saw your normal periods. Even if your periods have been irregular for a while, you need to record it somewhere, and then you should be having this information with you. Actually, I have many clients, I have many of my clients on WhatsApp. They actually send me this information. They have done proper charting of their menstrual cycle, how it has been moving. And remember, you can consult me on WhatsApp. Consultation is free of charge. Send your voice notes, send your questions, and I can always answer your questions as soon as I see them. So remember, I'll give you my WhatsApp numbers later on as we are moving on. So you need to have a proper record of your last normal menstruation period date. If at all you've done proper charting of at least 3 up to 6 menstrual periods, then it is actually very important. Next, you need to have a record of any previous medications you have been on, because actually many of our clients, they come in and they tell you they have tried the Clomid, they have tried letrozole, they've tried all the fertility treatments. So it is very important to have this record so that it will serve as a guide for to help out your gynecologist so that they can know exactly at what step should they intervene in their management. Next is that you also need to record any key questions you might be having as a couple, the questions you'll be able to ask the gynecologist. So next thing is that you should also note down any signs and symptoms of infertility. So in summary, the key questions you need to record down, the questions you are going to ask your gynecologist include your last normal menstruation period date. If at all you do charting of your cycle for at least 3 to 6 cycles, it is very much more important. Next, you need to have a record of the signs and symptoms of infertility, and this may include actually painful sex. They may also include low libido in your male partner, and then also they may include other signs, for example, having issues with periods. Next, you need to realize that around 40% of the couples have issues with fertility. Remember, today we are talking about the causes of male infertility. Much as this channel we talk about women's health, but we cannot leave the men outside, because a woman alone cannot make pregnancy to happen. So it is very key to address the issue of men also. It is actually very key. Next thing is that we are going to go straight away to the causes, and without further ado, the first cause of male infertility is that normally when there is complete absence of sperm, normally this brings about what we call male infertility. But remember, before we go to these causes, we should realize the fact that these causes can be identified after doing some tests. The test that is normally done is what we call a semen analysis test. A semen analysis test is where a sample of the semen of the male partner, after giving them a bottle and then they ejaculate in that bottle, normally the semen is analyzed for the quality and the quantity. So after doing analysis and the reports come back, normally if at all there's been infertility due to the man, these are actually among the commonest causes of infertility. So if you are a man out there and you have tried to make your woman pregnant and things are not working out, you might consider looking at these points we are noting here. You just may never know. There could be one or two key areas which are matching with the report you got from your doctor. And remember, if at all you discover that you could be having any of these causes, always consult your gynecologist, consult your doctor. You can send me a message on WhatsApp and we can advise on what next steps need to be done. So the first cause is normally when there is a complete absence of sperm on your semen test. Normally we call this azoospermia. The first cause of male infertility is complete absence of sperm. You can ejaculate, you can be with your woman and you ejaculate, but normally the ejaculate or the semen may be lacking sperm. So when they do the test and then they discover that there is complete absence of sperm or the sperm cells, normally then we call this azoospermia. Next is when there is low sperm count. It's also known as oligospermia. Whenever a man is having issues with sperm counts, when there is low sperm counts after doing the lab tests, normally this can be also a key cause of male infertility. Next cause of male infertility is abnormal sperm shape. It's also known as teratozoospermia. So abnormal sperm shapes, because we know that a sperm cell has actually the head, the neck and the tail. So if at all we have a sperm which is having an abnormal shape, then normally this can be one of the causes of male infertility. Next cause of male infertility is problems with sperm movement. Remember, we said that a normal sperm has the head and then also the neck and then the tail. So when there is abnormal sperm movement, when the tails are really very small, or if at all the sperms are there but they are lacking the tails, then normally movement may not take place, and this can bring about male infertility. Next cause of male infertility is sperm that is completely immobile. It's also known as necrozoospermia. So sperm that is completely immobile, remember it is lacking the tails, but even though the tails are there but it has low energy, it's not really able to swim the whole way along the woman's womb up to the fallopian tubes, up to that part which is known as the ampulla, where it can meet the female egg. Normally this can also bring about male infertility. Remember, you cannot sit at home and discover these causes. You cannot discover these on your own. You have to see your doctor, your professional, or your gynecologist, who will actually do what we call a semen analysis test, and then these results will be shown. Next cause of male infertility is the sperm may be alive and not moving, or they may be actually dead. So normally it is very important to do the semen analysis test so that these can be identified if at all they are there. Problems with sperm delivery due to sexual dysfunction. Remember, we talked about low libido. And obstruction. If at all a man has issues with obstruction, it's also known as retrograde ejaculation, whereby when a man ejaculates, instead of the sperms moving through the penis, they actually go backwards to the bladder. Normally, this is known as retrograde ejaculation. It is also brought about by obstructions or previous vasectomy. Vasectomy is normally a procedure which is done where the tubes are actually cut. So, if at all a man has any of these, normally they can end up with what we call male infertility. And lastly, if at all there are problems with erections or other sexual problems, for example, ED. ED, also known as erectile dysfunction, is among the top causes of male infertility. It is very important to always consult your doctor in case you are having or you experience any signs with libido, any signs with at least failing to make your woman pregnant for at least a period of 6 months or even 1 year. So remember, my friend, it is very possible that you can get pregnant. The best advice I can give you is that you need to get advice. You need to get help. You do not need to sit, because normally this can have a psychological impact on you. And normally, remember, the hormone which is actually responsible or which plays a big part in sperm production, also known as testosterone, still it is being produced, and it is also affected by high stress levels. So instead of really feeling guilty and then sitting helpless, it is very important that you seek help. You come out and you talk about it. When you talk about something, normally solutions can be found. Where there's a cause, there's an effect. So we have talked about the causes of male infertility, but we should not also forget that if at all a woman sees her periods on maybe on the 4th or 1st day, and then she counts the 14 days to her ovulation date, that is day 1, day 2, day 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. 17th being her ovulation date, our 14th day. Normally, you should also know that at least before we actually said that maybe the man has issues with fertility or with male infertility, it is also very important that couples understand the ovulation calendar. On this channel, I talk about the ovulation calendar a lot. Go to any of the videos we have uploaded. There are lots of topics about the ovulation calendar. But despite the fact that you have tried calculating your ovulation date and maybe things have not worked out, it is high time you may need to consider getting advice. But remember, I'm requesting that you subscribe for new videos I put out every day. And then also remember, you can talk to me on my WhatsApp. It is +256 701 79 78 76. You can also talk to me on my WhatsApp number. The other number is +256 787 66 8962. You can ask me all your questions. May God bless and protect us all. And remember to subscribe for new videos I put out every day. Come back tomorrow for another video I'll be putting out. I talk about women's health, and also I talk about men's health. And also remember, you can ask me all your questions. Check the description for details. Hello, welcome to our channel. I'm GERALD MASSA, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. The ovulation calendar, get pregnant faster, the complete guide. Ovulation calendar, get pregnant faster, the complete guide. This is my new ebook. It talks about ovulation. It talks about all the rules you need to follow, everything you need to follow if you are looking at getting pregnant. Get your ebook right now. Order for it on my WhatsApp. You can send me a message. It is +256 701 797876. You could also send me a WhatsApp on my other number. It is +256 787 668 962. Order by email. Also, you can send me an email on ovulationebook@gmail.com. That is ovulationebook@gmail.com. Get your ebook right now. If you are looking at getting pregnant, you will read it. There are lots of steps to follow. They are easy to understand. Get this ebook right now. It goes for only $20. Order for your ebook at only $20. Send me a message and I will show you how you can purchase your ebook. When you get this ebook, you'll be able to determine ovulation. You'll understand the common problems with ovulation, the common drugs for ovulation, and then also you'll be able to improve male fertility, because you may be thinking that you have issues when there are issues with your partner, when maybe he has issues with low sperm count, poor sperm quality. So I talk about all this in this ebook, and then also you'll be able to determine, you'll also be able to have sex, and then of course to determine gender selection. You'll be able to time sex for gender selection, and then also you'll be able to have all your questions answered about ovulation. Get this ebook right now, because the biggest problem most women seem to have with getting pregnant is determining when they are ovulating, and then their most fertile time to be pregnant. In this ebook, I've got all this covered. Just order for your ebook today and you will be able to know, you'll be able to begin on this journey of getting pregnant very easily, knowing that you have a guide, you have a book you are reading, and it's giving you tried and tested information which has worked for many women. It has worked for many couples. Get your ebook right now. To order, send me a message on +256 701 7978 and 76. That is +256 701 7978 76. You could also send me a WhatsApp on my number. It's also +256 787 668 962. Send me a message showing your interest, and I will show you how to order for your ebook, how you can purchase it. It will be delivered straight to your email once you submit all the details. And then also you could send me an email on ovulationebook@gmail.com. Get your ebook right now. Ovulation calendar, Get Pregnant Faster, the complete guide. It goes for only $20. GERALD, MASSA, the health educator, my names, and please connect with me and you'll be able to get this ebook. Have yourself a fantastic and healthy day. Bye bye.